Good afternoon. Thanks everyone for joining a few minutes early. We'll be getting started in about 3 minutes. If you'd like to check out the handouts pod, there is a copy of today's slides you can download from there. And also, please go ahead and put your questions into the questions pod. We'll get to some of those in today's presentation if we can, but if not, we're collecting all questions and we'll have another format for responding back so that you can share and see answers to a lot of common questions that we're collecting and hearing. Thanks, and we'll get started in just a couple of minutes. Good afternoon, everyone. Thanks for joining us for our presentation about employers and the Families First Coronavirus Response Act. Appreciate your being here this afternoon. This is an encore of our presentation from this morning. I know that some of you had trouble getting into this morning, but we're glad to offer this second chance and a third chance tomorrow at 11 a.m. Eastern. Please check out in the handouts pod. There's a copy of today's slides in a PDF format if you'd like to download those. Also, as you're going along, if you have questions, please go ahead and put those into the questions pod. I'm not sure in our limited time today we'll be able to get to all of those. We have collected some questions in advance that we will be answering. Our team of experts will be answering at the end, and we appreciate your joining us today. So speaking of our team of experts, let me introduce our presenters today. Deb Walker is our National Director for Compensation and Benefits. She works with employers to figure out the tax rules for rewarding, retaining, and retiring their employees and working on plans to help them do that. Kyle Fergone is a director with Cherry Beckert's Benefits Consulting, which is the team that find solutions for employers and businesses regarding group health and other benefit plans, as well as he works on property and casualty concerns for businesses. And Kathy Stanton, who is a partner and our national leader for state and local tax services. Kathy and her team of SALT professionals deal with a constantly changing landscape of state and local income taxes, sales and use taxes, property taxes, incentives and credits, and of course, employment taxes, which we'll be talking about today. So with that, let's go ahead and get the presentation started. So a little bit of background here, just to let you know where we are and what we're taking a picture of in our presentation. Back on March 6th came the first bill, or phase one, of the Congress and the president's response to laws that would be helpful in spending appropriations for coronavirus relief. And that was really to fund healthcare. It was billions of dollars for the CDC and for health care centers and other funding that way, also for funding to look for research to find vaccines or other ways to mitigate the issues of this virus. Then on March 13th, we had the state of emergency declaration for the entire United States, and that allows federal agencies to act, to loosen regulations, to make things happen along there. Then on March 18th, Congress and the President signed into law the Families First Coronavirus Response Act. That really provides immediate relief for workers and for employers via tax credit system. And that's what we're going to be concentrating on today. And of course, phase three is the economic stimulus bill, and that's going through Congress right now. The Senate's CARES Act, and we'll be talking about that as soon as it gets finalized and passed and signed by the president. Of course, along the way, there are other announcements and things. We saw a change in the filing due dates for tax returns and tax payments. There was an IRS announcement about high deductible health plans, that these could cover coronavirus costs. So there were other activities going along in the meantime. But we're concentrating today on the Families First Coronavirus Response Act, or the ACT. And so, Kyle, why don't you start us off and give us an overview of the new law, and particularly just announced was an effective date for the paid leave portions of this act.
So as of yesterday, the DOL did announce that the FFCRA provision will be effective April 1st. And that will apply through the balance of the year, so go until the end of 2020, December 31st, 2020. Therefore, the tax credits can be applied for the second quarter for employers that have less than 500 employees working in the United States. And the measurements for those are going to be based off of the FMLA and the FLSA accordingly to the different provisions. So the FMLA, Emergency FMLA Act will use those rules, and the Emergency Paid Sick Leave will use the FLSA measurement rules. Moving on, and we're going to be brief on these because these are a lot of the provisions that most should already know, and we'll spend a little bit more time dealing with the credits and the state tax issues. So 4 main components of the Act. First is the COVID-19 testing. This Act requires that all employers with sponsored health plans cover the costs and services related to COVID-19 testing without any cost sharing, prior authorization, or medical management requirements. This applies to all groups. This doesn't have the 500 limit like the others will, like the emergency paid sick leave, the emergency FMLA, and the refundable tax credits. So we're going to dig into those in a little bit more detail here. So the emergency paid sick leave is for all public employers with at least 1 employee, all private employers with 500 or fewer. If you have less than 50 employees, you are eligible for an exemption if the requirements will jeopardize your business as a going concern. The DOL does suggest that during this period, you should document your criteria set forth by the department for this exemption, but those details will be addressed in further regulations. We don't have any more current guidance on that right now. The benefits, who's eligible? Those are employees that are unable to work or telework due to an isolation or quarantine relevant to COVID-19. I think it'd take a second here to define isolation and quarantine, or briefly. There is further guidance and for more precise definition for this from the CDC and Department of Health, but essentially isolation means the separation of those that are infected, separating them from the healthy. Quarantine is the opposite. It's the separation of the healthy from the infected, essentially. So as mentioned, the CDC does define that more precisely, but that's a brief overview. If you are self-quarantined as advised by a healthcare provider, you'd be eligible. Or if you're experiencing symptoms and are awaiting being diagnosed or tested for COVID-19. Note the colors here, the blue and the red, those are equivalent to the benefits we're going to talk about in a second. The next qualifier is those caring for an individual that is subject to either of the above, or you're caring for a child whose school or childcare is unable or is closed due to COVID-19 precautions. And anyone experiencing similar conditions as specified by the Department of Health and Human Services. We'll say that one has been a little bit vague and looking for more clarification on that definition going forward. So how much do employees receive? So for emergency paid sick leave, they get up to 80 hours based on their regular rate of pay or minimum wage, the greater of. Those benefits are not to exceed the following. If you are one of the first three definitions, you get $511 per day, up to $5,110 for total isolation, quarantine, self-quarantine, or experiencing symptoms, as we mentioned on the previous slide. For the last few, it is $200 a day, up to a max of $2,000 for caring for others. During this time, employers cannot require anyone to use their leave during this period, so they are eligible for the benefit. Well, moving on to the next feature, the emergency family medical leave portion, which applies to all public employers, and again, private employers with fewer than 500 employees, which is again defined by the FMLA regulation. The DOL here as well has offered the exemption for 50 or fewer employees, as we addressed earlier on, to monitor that, and further regulation will come, or further clarification will come. So any employee who has been employed for at least 30 days is eligible for the benefit if they are unable to work or telework during a school closure or child care closure, and they have to care for a minor child. Excuse me. The benefit is then paid after the first 10 days of leave. During that period, the employee is allowed to use any PTO, vacation, sick leave, or they can also apply the emergency sick leave to that 10-day waiting period. Once they are eligible and able to receive benefit, they do get 2/3 their pay, not to exceed $200 a day, or a $10,000 max for the 10-week period. So here we are addressing if for employees less than 25 employees, once an employee is on FMLA for the relevant reasons, does the employer have to restore the position? Yes, you do, unless, again, you're under fewer than 25 employees. And at that point, if the position is unavailable due to any economic conditions, they are not required to, but they have to make a reasonable effort to restore the employee at an equivalent position. If that is not possible, they at the least need to stay in contact with the employee for a year if any equivalent positions do become available at that time. So that is a brief overview of the provisions that are in the law. We're going to turn it over to Deb or Sarah right now to take over for the relief and the provisions and the credits. Thank you.
Great. All right. Well, we are moving forward. So we've talked about what the employees can apply for and claim and get paid for, but how is the bill providing relief to employers? Deb, you want to walk us through that and some examples?
Sure. So what Congress did was provide for a payroll tax credit equal to 100% of the paid family and or paid sick leave that someone has to pay, that someone pays to an employer. That credit unfortunately doesn't apply to governments, but for all other employers, it is equal to the amount that they pay to the worker that's out on sick leave and emergency paid family leave. Those amounts are also not wages for the employer portion of OASDI, and they are, however, wages for the employer portion of Medicare. That employer portion of Medicare increases the credit that the employer can claim. And the employee needs to pay federal income tax and its share of OASDI and Medicare out of the wages, these paid family leave wages that they're getting. So how much tax credit can be generated? The tax credit is directly related to the amount that you pay under these programs. So it's equal to the amount that Kyle talked about, up to $200 a day for emergency family medical leave, and up to $200 a day or $511 per day if it's paid sick leave, depending on what the reason is that it's paid for. So note how it works with the paid sick leave. The paid sick leave can apply to taking care of a child or taking care of somebody quarantined. And if it's taking care of a child, it can be used to pay for the first 2 weeks that somebody's off, which would be unpaid under the emergency paid family leave. I think we'll see this more when we go through some examples. The other thing is, the third bullet here is that there's credit also for any health plan expenses that the employer continues to pay for these employees that are on sick leave. So how do we get the credit? Well, I think Congress did a great job, and the IRS has come out with guidance that's expanded it. And so it is now clear that you get the credit by reducing a payroll tax deposit that you would otherwise make during the week. So we'll see in the example where you collect federal income tax from employees, and you can collect employment tax from employees, and the employer pays some employment tax, and all of those amounts have to be deposited fairly soon after you make payroll. Well, now, before you deposit them, you reduce the amount that you're going to deposit by the amount of paid sick leave and paid family leave. Now, if you have so much paid sick leave and paid family leave, then the tax credits are going to be refundable. And we haven't been told how quickly they will be refundable. The government could issue a separate form, but absent a separate form, it could be as late as when you file your Form 941 for the quarter in which you've made the payments. Just real quickly, the other things that are on there is that you can't get a tax deduction for these amounts that you pay that you're also going to get a credit for. So let's move on to the examples, because I think they highlight a number of things. First of all, in this example, I'm going to assume that we have 100 employees and a weekly payroll of $250,000, which I then kind of computed, okay, what do I think the taxes to be deposited for the whole weekly payroll of $250,000 would be? And it's going to be $68,250 made up of these three separate components. And then in this example, we're going to assume that this employer is paying $150 a week for each employee of the whole 100 employees. Okay, so look at employee A. A earns $350 a week, and he's self-quarantined under doctor's orders. As of April 1st, the employee can pay emergency paid sick leave for this individual. And now we're going to compute what the amount is. So we start with his $350 a week, which means he gets $70 a day. And the payment is the lesser of $511 per day, or his daily wages, his daily rate of pay. So he gets $70 after 10 a day. After 10 days, he can either claim accrued leave under his employer's PTO plan for additional paid time off. So, or he could take, because he's sick, his only choice is sick leave or PTO. If we go to example B, now this person earns $5,000 a week and he's feeling sick, but he can't see a doctor. And this brings us to the point, what kind of documentation do you need? And in general, when an employee tells you something, unless you have reason to believe it's wrong, then you can assume what they're saying is correct. So he's told you he can't come to work because he doesn't feel good and he can't see a doctor. So as of April 1, if he's claiming sick leave under the paid sick leave provisions, which by the way, he cannot be forced to use other sick leave first, you're going to have to pay him $511 per day for 10 days or his average wage. Now here we have somebody earning $5,000 a week, $1,000 a day. So he's going to get $511 per day, and that's going to be what the paid, what the credit is. And then after 10 days, he can go on to whatever else his employer has.
But Deb, an employee is not required to claim the emergency paid sick leave. They could use, so if this employee wanted the $1,000 a day, they could go ahead and claim their PTO first. The employee is not obligated to claim the paid sick leave. They can choose how to apply their benefits, right?
That's right, but the employer cannot force them to use their paid sick leave first. The employee can choose, the employer cannot force them. So moving on to employee C earns $500 a week, and they're staying home to take care of children who can't go to school because of the coronavirus. So in this case, we determine again, if you make $500 a week, how much is that a day? $100 a day. The payment for staying home under the sick paid leave provisions that last for 80 hours or the Family Medical Leave Act is the same, $200 a day or 2/3 of your wages. So this person's going to get $67 a day for staying home when they're taking care of a child whose school is closed.
So Deb, if the school is going to be closed for longer than just 10 days, can the employee use PTO or even the emergency paid sick leave to fill that, what would otherwise be 10 days of unpaid gap before the paid FMLA begins?
Okay, so the example here is showing them using emergency paid sick leave, which only lasts for 10 days. Once you have used your 10 days, you can go to emergency family medical leave, the mandated paid emergency family leave. That applies after 2 weeks, but you've already used the 2 weeks here and gotten money from the paid sick leave provisions. So yes, you're going to go, this individual, because you qualify for family medical leave, which only pays in the case of somebody staying home to take care of a child whose school or daycare is closed. This person will now then go to family medical leave, and the 3rd week will be paid under those provisions. 3rd through the 12th week will be paid under those provisions. Now the 4th one is employee D, and they're staying home to take care of not a child, but somebody self-quarantined under doctor's orders. And in this case, we go through the same provisions. We determine how much is paid for a day. 3,000 a week is 600 a day. 2/3 of 600 is 200. So it is, 2/3 of 600 is 400, and the payment is the lesser of 200 or 400. So of course the payment is $200. So this employee will get paid $200 for staying home for 10 days for staying home to take care of somebody self-quarantined under doctor's orders. Note that because we're assuming it's not a child that's out because their school is closed, they can't then turn around and go to paid family medical leave. Their only option is unpaid family medical leave for another 10 weeks. Right. So the next.
Yeah, Deb, so this example where we took 1 day in week 1 for those 4 employees, just to simulate a calculation out and show how the costs incurred by the employees is paid for by the credit. And what's important here is to remember that the credit includes the health premiums paid while those individuals are out under one of these paid leave provisions.
Yeah, so you can see in the chart, we list down the gross pay, we take out the withholding amounts, and then over on the right-hand side, we show the credit, which is for the gross pay plus the health care plus the credit for the employer medical care.
And then just to contrast that, we wanted to take a look at what happens, say 5 weeks from now. And a couple of employees, we said, okay, they're back to work, but C is still home, the schools are closed, and is claiming that Emergency Family Medical Leave Act to take care of their children at home. And D is still off taking care of a family member, but is now on unpaid family medical leave.
Right. And so when we started to put together the chart, you can see that, you know, the total payments to these people, including their health care, is less than $2,000. And yet in our first example, we had $68,000 as a payroll tax deposit. And so the $68,000 is going to get reduced by these credits in order to immediately pay the employer for having paid these 4 workers.
Great. All right, Kathy. Boy, a lot has been happening in the states this year for all kinds of taxes, but how are the states responding to all of this activity?
Thank you, Sarah. Yes, we are seeing a lot of activity at the state level, and we expect to see a number of tax credit and incentives programs established, not only at the state level, but at the city level to assist small businesses. A lot of those that we're seeing so far are in loan programs, targeted loan programs, or in grants. So you're going to see a lot of activity going on. And so every day we're looking to keep up with it all. But today I'm going to touch on some of the changes that have been made in the unemployment insurance area. The state governors have issued executive orders to ease restrictions and actually it's just for the purpose of workers being able to get those unemployment insurance benefits quickly. And so the definition of workers that qualify for unemployment insurance has been expanded, and it's been expanded specifically for workers unemployed due to COVID-19. All claims can now be filed online as opposed to in person. The 1-week waiting period before benefits can be received has been suspended. And then the work search requirements has been suspended as well, as you can imagine under the circumstances. Additional guidance has been provided on how to expedite the claims process and also on what employees are eligible and not eligible for unemployment insurance. And I will stop there a minute and mention that the CARES Act also has some provisions. We'll see what ends up coming out in the final bill, but it also even further expands the definition of individuals that can qualify for unemployment insurance. And so even if you have a child at home that the daycare is closed, you may qualify for unemployment, or if the breadwinner dies from COVID-19, that the person who now becomes the breadwinner can qualify for unemployment insurance. There's a lot of expansion of the unemployment insurance and who it would apply to, at least initially in the bill. So we'll have to see what happens there. But the government definitely wants to get the unemployment insurance benefits to people quickly so that they can be helped in this current environment. Now, specifically with the state of Georgia, I wanted to bring to everybody's attention, if you have employees in Georgia, for any unemployment insurance claims that are partial claims, meaning that employees are laid off temporarily or reduced work schedule, that the employer now is required to file the claim on behalf of the employee through the employer portal. So the employer now has to do that. And there are penalties, and you may not be covered if that does not happen. That was effective March 15th. So again, temporarily laid off, we want to, or reduced schedule there. And also Maryland, similar work search requirements. We have a 10-week exemption, and also employers with 25 or more employees impacted, they have to, or it's not mandated, but they want Maryland to submit that information so that the state doesn't have to go back to the employer to validate whether the insurance claim is appropriate. They're having the employers do it directly, or encouraging the employers to do it directly, again, to get the money into the employees' hands. So North Carolina, same thing. Employee must file unemployment insurance online or by phone, but employer, again, can file if it's desired. And then the same thing with South Carolina, encouraging the employer to file that claim. Tennessee, the wording's a bit different. Again, you may get into some issues on substantiating, but it applies to workers unemployed because the worker left work after being directed by a medical professional or a health authority due to COVID-19. But again, I think you have to take your employers or your employees' word for it at this point, as Deb mentioned earlier. And mass layoff lists obviously need to generally have to be reported to the state. For the state of Maryland, there's a credit. This is not a new credit. And so we should also look wherever an employer has employees to the state's existing programs also. In Maryland, there's a refundable credit for small businesses of less than 15 employees that provide sick and safe leave benefits. There is a cap to that credit, lesser of $500 per qualified employee or $7,000 per employer. And this credit is actually applied for in January for the year prior. So this would be January 2021. It would be applied for the 2020 year. And then there are also some pending bills in Kentucky and Ohio. But what I would say is you're going to see there are probably today even more pending bills at the state level to provide relief to employers, to employees. So you definitely want to keep on top of that because there may be some benefits that you would deem very helpful during this time. So Sarah, that is what I had with regard to this presentation for state and local.
Great, thank you very much. All right, well, we have, like I said, compiled a series of questions that we have received from talking with our clients, and we wanted to share some of those questions with you because we think there's a lot of commonality about this. So Deb, why don't you start us off with these questions? What about paying for absences before the April 1 effective date? Do we have any guidance on that?
So DOL issued guidance just yesterday afternoon, which said that paid sick leave and paid family medical leave is effective April 1st. That means that, and the credit is therefore, and the credit is only for paid sick leave and paid family medical leave. So the credit is only going to be available for paying these for absences April 1st and later.
Is this the only for full-time employees? What about on-call workers or workers with odd schedules? How do you handle that?
It's for all employees, part-time, full-time, temporary. The DOL questions, which are on the DOL website, or we can send a link or talk specifically with you, but they go into a lot of detail as to how you calculate hours for somebody on commission or somebody that's paid on call. And basically it's a 6-month rule. You look back over 6 months and see what their average wages were and figure out a daily rate that way and can figure out what they can be paid. And
that includes overtime wages as well. I read that this morning, so. Okay. So, you know, we've talked about this. What kind of proof does an employer need to ask for about childcare? And is it okay if both parents request this leave? And, you know, where do we sit with that? There's no prohibition on both parents requesting the leave. And again, it goes back to the same rule that Kathy and I talked about, which is when an employer tells you that why they need the leave, then you can assume they're correct unless it doesn't make any sense to you. So it gets a little tricky if a husband and wife both work and they have only one child, that both of them have to stay home to take care of the one child. But you know, it's a facts and circumstances test, and just reasonable. And we were talking about children. we are talking, what, is it just any child, or how is that described?
So for family leave, it's a minor child, which turns on state law. And for the paid sick leave, which is a separate provision, it's a son or daughter.
Okay,
So
it's going to be a matter of checking those definitions as for qualification.
right, and the relationship of you to the person.
Great. Kyle, we had some questions for you. So what about, are these payments to employees reduced for 401k deferrals and federal income tax and those kinds of things?
Sure. The 401k is not mentioned in the provision, but you refer back to your plan documents. In there, it will define what is eligible for the deductions. As for the federal income tax, it is eligible, and it's treated as standard income.
Okay. What about, we hear this question a lot as employers are concerned about how deep their businesses are going to be damaged. What about if an employer furloughs or lays off workers, can these employees qualify for this paid leave and get the employer a tax credit?
Sure. If the employee is furloughed, they are still eligible for the benefit paid under FMLA and FLSA, or the emergency sick pay leave. If they're laid off, however, they are not, but they do become eligible for unemployment, which was just expanded, as Kathy mentioned. But when it comes to these types of questions, we highly recommend employers consult with their general counsel to address these types of questions.
Great. And I think there was a similar question about, hey, I want to make sure my employees still have some health benefits. Can I keep paying those while they're furloughed or laid off?
Yep. Again, it depends. If they're furloughed, they may be eligible for the benefits. So go back and refer to the plan documents and coordinate with either the TPA stop loss carrier or medical carrier. If they are laid off, they then become eligible for COBRA. So at that point, it's the employer's responsibility to provide that communication.
Okay, and Deb, one more question for you. What if you have several companies that are working together or interrelated or use a common paymaster or under common control? How is that going to affect this 500 employee count?
Okay, so for the Family Medical Leave Act, the question Q's and A's have addressed this, and basically they apply for both the sick leave and the family medical leave provisions, they apply the FMLA rules, and it looks to a common paymaster is when somebody works for two different people and gets paid by one. That person would probably be counted twice under the joint employer test. And under common control, it's not a rule like that we think, or I think about under tax rule. It's an integrated control rule where it's a facts and circumstances, management control, financial control, and the Q's and A's lay this out. And then you go to the FSLA, which you can click through to see how it's addressed in the regulations.
So definitely a complicated question, and I think the Q&As also talk about when to do this count of employees as well.
Yes, during the day of payment.
Great. Okay, well, let me just sort of wrap up this presentation. Basically, what should an employer be dealing with for next steps? Well, number one, we think, first of all, there's a couple things under this act. Implementing the COVID-19 testing in all group health plans, making sure that is in place, implementing the emergency FMLA and the emergency sick leave pay programs, making sure that your documentation is set up. That means revising plan documents. That means coordinating with your carriers and your vendors to make sure these are in place. Communicating with employees. I know DOL is going to send out more standard communications that you can post, that you can make available to your employees to activate these two plans. And I think something that's going to be very important is capturing this payroll data, being able to capture the payments, the healthcare payments, the taxes, the qualifications, so that you can apply for this credit and get that credit as soon as the wages are paid. And of course, keeping up with the changing landscape for state taxes and particularly unemployment issues and what role employers need to play in making sure information on layoffs is communicated to the employment offices in each state so that workers can get their unemployment benefits as soon as they are able to. So definitely some steps to take moving forward with this to implement it within companies. All right, so let us wrap up the presentation here. We wanted to highlight some of those resources. You heard Deb talking about the Q&A from Department of Labor. This first website link will take you to those questions and answers regarding the Family First Coronavirus Response Act that have been issued so far, and I'd keep an eye on that website because there will be more postings there. In addition, check out the irs.gov/coronavirus page, and there look for this information release 2020-57. This information release describes how the IRS is going to allow employers to claim the credit. It talks about how to take advantage of the credit now, what's included and can be withheld out of the total payroll deposits that employers are going to make for federal taxes, and also about their plans for creating the refunds and how to apply for the refunds. And finally, also, please keep an eye out on our own Sherry Beckert's COVID-19 Guidance Center pages there. So as we wrap up here, just wanted to point out that our professionals here, Kyle and Deb and Kathy, are all available to answer questions as you have them. Again, if you've put questions in the questions pod, I know Deb has been active answering a number of those. We're collecting questions from all of 3 of our presentations today and tomorrow, and going to put those together, and we'll be back to you with a response system. We're either going to do a podcast of those, or we're going to have those in some sort of written form so that you'll see what common questions, your questions and others are asking about this new law. In addition, we've got a lot more coming. I know people will be thinking about this along with how the economic stimulus bill may wind up impacting your choices under this plan and the other, and how to handle that. In the meantime, we wish everybody good health and good social distancing, and stay well. Thank you again for joining us today.